Okay. Good morning.
Thank you, doctor. Start with your name.
My name is Dr. Christopher Otabo. I'm an orthopedic surgeon, medical director, Alliance Hospital here in Abuja. I want to start by thanking the Honorary President for the opportunity to contribute my quota to the development of the healthcare of Nigerians and this privilege to talk to people.
Anybody where they anywhere where they follow this program, make you listen well. Oh. Anytime where Dr. Otabo talk to us, all of us, they go home with something new to either change our lifestyle or how we they follow our health.
Yes. Thank you. I also want to say happy birthday, Mom. Yes, she's my friend now. Yes, it's a privilege. Today I want to talk about low back pain. When people they call waist pain.
The one where ordinary president they pray for people.
Yes.
Say they no go suffer them.
Yes. Some people they call them rheumatism. Different names. Almost every one of us will get it. Yes. As we get older, we are prone to low back pain. And if I see 100 patients in a week in my hospital as an orthopedic surgeon, 50 to 60 of them will come with low back pain. Yes. So is that common?
Even me, I've been suffering. Again, when I suffer with, I don't know the one where they call sleep disc.
Yes, it's part of the causes of low back pain, and I will spend time to talk about that today.
Okay.
Yes. So it's very common, and it's one major reason why people don't go to work, as in the excuse duty. Okay. I'm tired of writing excuse duty because of low back pain. It's very, very common.
Oh, even for hospital, that one they happen. People where they work for hospital, they go there.
No. You know, as a hospital, if we are telling someone to go home and rest, we have to give them a paper to say to their office. Okay. So this is one of the commonest
they
reasons.
sweet you when you they write that say make them allow this man rest.
Yes.
In back. But not only men they suffer waist pain, or women they
men
suffer
and
too.
Women, all the sex. Yes. Okay, so when anywhere from below the rib, when you have pain from below the rib cage down, then that is what we call low back pain.
Use this thing show us, make we see where the below the ribs they.
So this is the rib. This is the rib cage. This one. Yes, any pain from here down to the hip, we call it low back pain.
Low back pain.
Yes.
Okay.
And it is, yes. There are so many causes of the low back pain. I will talk about it. I've talked about how common it is. Yes, commoner as we get older than 30. So one of the major reasons is because of the disc, the intervertebral disc. Please just bring the skeleton here. Okay, so you know the backbone is made up of small bones that we call the vertebra. Yes, but they don't sit on each other directly. Okay. There's an intervening soft tissue like a shock absorber.
The same shock absorber where they did for motor.
That is a description. Yes, so that disc, as we get older from around 30, it becomes soft. Instead of that springy nature, when you put weight, it will compress. When you remove weight, it will spring back. Instead of that, it becomes like a putty. It becomes soft. So when there's certain pressure you put on the back, it will just push from where it is. We say the disc has slipped.
Okay, it go come out from in position.
Yes, and when
it no go green return again.
Yes, when it come out from in position, it will put pressure on the nerves because the spinal cord is around the corner, and the spinal cord gives off nerves. These yellow ones, they are the spinal nerves. These ones, they travel down to the legs. So if the disc slip at this point and put pressure on the spine, the nerve, then it's going to cause pain both around the back, and some of them it will shoot down to the legs.
Doctor, if you see pain where I get that time, if you touch me anywhere, say it be like toothache where we say when it mature, you no go know whether na this side or this side, whether na your eye or your ear. You touch me for feet, I go think say na there the pain there.
Yes, so it can be very troublesome. It's one of the most painful things that is known to man.
I don't even believe I go feel walk again when that thing happened to me.
Yes. So the disc, intervertebral disc prolapse is the commonest cause of low back pain. Other causes, maybe muscle sprain. It's very common for us to hear that from patients that I was just trying to lift up this battery or this bag of rice, and I heard Ken at my back. What has happened is that the disc has slipped.
Now, so you do me first,
and that can become the beginning of many years of pain if it's not properly treated. Yes, so that's slip disc. And then the way we lie down too, if we slouch, if we are sitting improperly. When you just lie like say you not care, you know,
okay,
you just throw away your body,
throw away, scatter them anyhow.
Yes, it can also lead to that kind of pain, back pain. The way we sit, then this back pain is also very common in long distance drivers, taxi drivers, and long distance drivers because they are sitting for too long.
Then what people when they work for office?
Yes, chief executives who sit down all the time, 8 hours, 10 hours treating files. After 5 years of being in that off position, they come back to us with low back pain. Yes, so those are some of the
things. Saying now because they be big men, I make those things they happen to them.
No, there's no big man in pain. It's just what predisposes to it. Then those who lift objects, it can also happen. So apart from all these ones, we also have some other conditions that causes low back pain, like tuberculosis of the spine. A lot of people think that tuberculosis is just only cough. No, there are different types of tuberculosis. The infection can affect any part of the body. I have operated a patient that had tuberculosis of the brain. Yes, he has abscess in the brain. We removed the skull and brought out the pus. So tuberculosis can be anywhere. It can be in the kidneys. It can be in the lungs. But the lungs one is the one that
now
causes
the one
cough.
where they hear.
Yeah, that's the one
time.
that can also spread easily because when they cough out, people inhale it. But the other tuberculosis is hidden in different parts of the body. You have to suspect it as a doctor before we run the test. And many times, once it's positive, you treat it. That takes care of the low back pain.
So for brain, you go open the skull.
Yes. If anything is competing with the brain for space, whether it's blood, pus, or any type of infection that is increasing the pressure, you have to open the skull and bring it out.
And they go still heal after?
Yes, they'll heal and they'll be fine.
Aha.
Yes. Whether tumor or anything. So another cause of pain, which is not directly related to the back, is tumor. When, like for instance, men that have cancer of the prostate gland, if it has advanced and they didn't know on time, it can spread to the spine, and then the bone will be eaten up, and that can lead to low back pain. Even cancer of the bladder, then stones, urinary stones, like bladder stones or ureteric stones, they all also contribute to low back pain. So I'm not going to dwell too much about the technical part because I don't have much time, but I'll talk about the treatment. Majority of low back pain would go on their own, especially with bed rest. Yes, so when you have that pain and you heard that pain at your back and the pain is there, just go lie flat on the bed. Those days, before medicine advanced to this level, we used to treat many of those things with traction. We would tie traction on the leg of the patient and tie them to the bed. So they are there. They bring bedpan for them to do whatever they want to do there. And after 7 days, they get up and they are happy. And many times, they believe erroneously that it is the traction that has treated them well. But the truth is that the traction is just to enforce bed rest. Because once they tie you to the bed, you can't move. And as long as you're not jumping around, the place will be healing. Yes.
Now, so they do me that time for Gariki Hospital. They put me for bed, carry 3.5 kg.
Yes.
Tie for this leg, carry tie for this other leg. Now, so I did there like this. Lie down for 1 whole week.
Yes. That actually, the job was being done by the bed rest, not the traction. The traction is to ensure that you stay in that place.
I can't say now the thing where they tie, now they put
Yes.
And doctor.
So when people have
Doctor, I know say your time don't complete, but I go still give you extra time.
Okay.
Yeah. Because sometimes when they share these experiences, they help people learn or connect.
Yes.
1 week where they keep me for hospital, it can't be like say I done well. I can't check my bank account. I see say the thing don't they raid. I tell them say may they release me. I don't do okay. They talk say you never do. I say but now I can stand straight on like before. They talk. I say no, may they release me. They release me. Say make I come back in 1 week time. The 6th day where I suppose come back, they go everything they okay. I just finish bathing. I enter. I look my bed like I say, "Kai, this bed too scatter. I go leave them like this go." And they don't talk am say as you make your bed, now so you go. Like I just carry one hand, make I bend down, push one of the bed sheet. I hear come. The noise where I hear, now so I drop for ground, sweat for my body. I no fit stand. Now so I crawl. Now stretcher. They bring wheelchair. I no fit sit on the wheelchair. They return back. The ambulance come bring stretcher. Like say I been hear them agree to stay small for day 1, 2, 3 more days.
Yes.
Because they say, you don't know my body, I don't well. They say, no, you never well, I no agree here.
We have this very often. So I always tell people, if you bring yourself to a specialist, you should have faith in what the specialist tells you. I'll give you an example.
My own money. I talk, I'm saying my account don't read. And nobody say I don't want here.
No, but health is wealth. Health is wealth. Okay, there was a patient that came out, so I'm not mentioning him, so nobody knows, that came with myocardial infarction to the hospital this week, earlier in the week. The heart, the muscle of the heart is diseased because the blood supply to that place is affected. So when we made the diagnosis very clear on ECG, we said, look, you need to do something else so that we can open up that blood vessel and keep you alive. The patient was telling us that it's ulcer that is disturbing her, that she wants to go home. I said, you can't go home, because if you go home, even we looking at you like this, we are worried because the heart can stop anytime. Don't go home. She said, no, she's going. I had to say, I beg. I said, give me your brother's number or whoever I can call. I had to call the person to come to the hospital, and we had a meeting with them. We are still on the matter as we speak. So we see things because of our training. We see things that you patient cannot see. It's not wise to argue with the doctor. The best you can do is to get a second opinion.
Doctor, I know
yes, the safe thing to do.
I know say you they do this always. Yeah. This one where they talk now. If you corner that man by the corner, tell him, say, bros, why you won't kill yourself now waiting? Now the money, he go talk through. And
no, we never reach money.
But now money, even as you never reach, you know.
No, but
corner him, doctor. Corner him. This thing why I tell you now, go try him.
Okay.
He go tell you say.
But now they alive, they talk all night, they get money problem.
So why I talk say even you, many times people don't come to you, even for this program where we say they no get the money. You support within the limit where you go fit support. Sometimes when you look patient well, you see them they agitate. Now money of course they worry.
But you go talk now, so that help will come in any way. If we agree that you want it, and then money now becomes the problem, then we'll now know that is a new problem, not that you are putting
this one where you talk. Yes. I agree. Make it not be like so now they force them.
Exactly.
I agree.
Yes. Okay, so I said treatment, bed rest. Bed rest will solve over 80% of back pain. But there are some stubborn ones that only bed rest cannot solve. Okay. So we do other things. Yes, like for instance, this is what we call the lumbar corset. It's a waist belt. We tie it around the waist, firm. It helps to grip the muscles and prevent unnecessary movement.
They give me one where can be like Gedo that time. They wear them. When I wear them like this, I could be like, you know this thing where women they wear.
Yeah, that might be this now. Yes.
I can't they look stomach where so I want carry and tie.
You really get the experience. So so it's easy for me to connect because you've gone through the experience. Yeah, so this one we can use it for not more than 2 weeks. Okay. Because after 2 weeks, it can begin to weaken the back muscle. And then, yes, it will cause more problem. But within that 2 weeks, if you use it and it will hold you firm, a lot of my patients they do well with lumbar corset. Okay. It's one of the things that we, then change in lifestyle. If you have low back pain now and that process has started, you have a higher chance of always getting it, except you change your lifestyle.
Yes.
For instance, if you are a frequent flyer and you do long haul flight. Some people will say I flew from Lagos to London or to New York, and the moment I came down from the aircraft, the pain gripped me. What was he doing for those 12 hours? He was sitting down. Wrong. Every 2 hours, 1.5 hours, you should get up and walk along the cabin to free your back, because gravity is pushing your weight on your back and it's already diseased. So you're going to have the same thing with road travel, especially our road that is full of potholes, bumps here and there. You can't do from here to Enugu, from here to Meduguri, and then you will not have a problem. There's going to be a problem. So you take a break. If you can control the journey, after 1.5, 2 hours, tell the driver to hold on, and then you stretch, take a walk, come back again, continue your journey. So as you break the journeys, you free the back a little, and then that can help, prevent acute exacerbation of the low back pain. Then if you want to pick something from the ground and you already have that condition, don't go directly, you have to bend your knees.
Okay.
Yes. If you do like this, you pick.
Okay.
I'm doing this because I don't have back pain. But if you have the back pain, or it's already established that you have that condition, when you want to pick something from the ground, you bend your knees.
This one good.
Yes.
Una no go appreciate doctor. How many of una know this one before?
And pick it.
No,
because
you go show him again. Just show him one more time. Show him slowly.
So something is on the ground. If you do this, you can.
And not the traditional way many of us they pick things for ground.
But instead, if you do like this,
and not be saying a guy they do.
You have freed your back. Then you pick it. Yes. So that will prevent loading the back, and it can prevent the frequency of you coming back to the hospital with acute attack of that low back pain. Then we also give medications, physiotherapy, massage, all sorts of massage. But we have different types of massage therapies, both the ones that know what they are doing and the ones that don't know what they are doing.
That one, true.
So it's advisable to meet someone who knows the basis.
Before you go scatter them.
Exactly. Because some people say, I went for massage and it got worse. It will get worse because the person didn't know what he was doing. So infrared, all those things. So I just categorize that under massage. Then, of course, medication, anti-inflammatory medications, that can help. But some people have developed ulcer because they are always taking those pain relievers because especially the laboring public, like laborers, farmers, every day they must work, and every day they have the pain.
It gets one way, I don't know the name. Then the most of in fact they say more for the West, and they open them like this, they put them for like powder, put them for mouth. You go see them swallow. Exactly. Sometimes they say they taste like aspirin or
exactly. You're right. So that is also is a form of abuse. They end up with ulcer, and so at the end of it, they have back pain, they have ulcer. We've seen a lot of patients like that. So the medication must be controlled so that it doesn't produce that side effect. But no matter what you do, in 5% of patients, they will end up in surgery. Yes. Yesterday we did one spine surgery, 6 hours surgery yesterday. For a patient that had the back pain, it was not going away.
6 hours?
Yes. Yes, yesterday. It's
every month we go take avoid them, doctor.
No. Every month we do like between 5 and 8 spine surgery in my hospital for just low back pain or neck pain. Yes, those are the two areas that are affected. Those ones, you have done everything. And there are some stubborn ones that no matter what you do, it will not work because the nerve are being pinched.
Okay.
And yes, and patients have severe pain. For them to walk from where I am to where you are, pain. They just can't bear it.
Now, so it be me that time.
Some weakness.
When I go they walk like person where get high knee. I go they draw my leg like this.
Yes. So those ones, you try everything. You try the non-operative. You even give injections. There's some epidural injections that we can give to some people. But if all that don't work, and then we do MRI of the spine, because MRI is the gold standard to evaluate the spine. Okay. Once the MRI shows nerve compression, and there are some surgeries that are emergency. When the back pain is associated with loss of sphincter function, that means person cannot control his urine, He cannot control his stool. That as an emergency is Cauda-Equina syndrome.
Hey.
You have to operate.
It's called what?
Cauda-Equina syndrome.
Cauda-Equina syndrome.
Yes, it's the nerves that control those things. They are now being impinged, and if the pressure is not relieved within for 24 hours, it can be permanent. That means that no loss of control, a loss of urinary and fecal control. That's not good. So when you have severe back pain and you notice that your urine control, you can't control urine and stool, start running to the hospital. It's an emergency, and if that's not the time to say you want to go and seek, you better submit yourself to a specialist who would operate it. Otherwise, it's to just be a lifetime of regret for the rest of the life. So those are some of the things about low back pain. I see that